Hello, you guys. Here is our answer and rationale to a question I posted a few days ago. So, the nurse is caring for a client following a head injury. Which activity, if performed by the client, would indicate understanding of measures to prevent elevating intracranial pressure? Woo! I know that's a loaded question, seems like, right? But hey, that's how some of these nursing exam questions are. That's how some of the NCLEX questions are. So you kind of have to just get into it and break it down. And you know, the number one rule, the number one test taking strategy by Apex Nursing Academy is to repeat the question. So, anytime you're taking your nursing exam, NCLEX exam, just run through and repeat the question before you drop down to the answers, right? Now, after you do that, you want to be thinking about recognizing cues. Recognizing cues is just asking yourself, what is the significant data? Picking out the significant data from the question. Here I've highlighted the significant data. Who are we talking about? A client with a head injury. What is it asking us? Measures to prevent elevating intracranial pressure. So we need to be thinking about intracranial pressure, client with the head injury. That's recognizing cues. We also want to note that this is a positive query. Now, a positive query question is looking for the correct answer. So the client is going to be telling us the correct answer. So you want to keep that in mind when you're picking your answer choices, right? Now, here is where content matters. We get to use our nursing knowledge. Now that we know kind of what the question is asking us about, we want to start pulling all our nursing knowledge about intracranial pressure, increasing intracranial pressure, things we do, things we don't do. Think about decreasing environmental stimuli. Think about avoiding straining activities, coughing, sneezing, exercising. Put all your nursing knowledge to use. Bring it all to the forefront at this point, okay? Now, let's go back to our question. Look at those answers. Now, the correct answer was D, but let's see why. Blowing the nose. Blowing the nose is going to be forcing that pressure in the head. That is not going to help with intracranial pressure, okay? Isometric exercises. Even if you can't think of or don't know what isometric exercises are, any kind of exercise, we don't want this patient with the head injury potentially having intracranial pressure. We don't want them exercising, period. Vigorous coughing, we don't want them doing that because, again, vigorous coughing is putting that force in the head, and we want to think about measures to prevent elevating intracranial pressure. All right. So exhaling during repositioning, yes, that is helpful to prevent elevating intracranial pressure because if that patient is trying to scoot a little bit, trying to move, trying to reposition, exhaling, just letting that breath out, that's a calming effect, a relaxing effect. That is a measure that's going to help prevent elevated intracranial pressure. So if a client tells you that, that client is indicating understanding of measures to prevent elevating intracranial pressure. So D is our correct answer. And there you go. We broke that question down. We made it make sense. And that's what we like. You guys have a great day, and we'll see you next time. Bye bye.